Care for the victim is divided into two categories. Primary care assessment, which deals with immediate life-threatening situations, and secondary care assessment, which covers illnesses and injuries that are not immediately life-threatening. Both the primary and secondary survey include the action steps learned in assessment of the scene. Activate 911. Inform the victim you are trained in first aid and ask for consent to help. Don personal protection equipment. When aiding someone, use the acronym AID, A-I-D. A. Activate 911. I. Inform the victim you are trained and ask for consent. D. Don personal protection equipment. Primary care assessment. Are they responsive? Ask the victim if they are okay. Is the victim breathing? Check to see if there is no breathing or no normal breathing, such as agonal breaths. Is there serious bleeding? Look for artery wounds. Artery wounds are immediately life-threatening and spurt in time with the heartbeat. The blood will be bright red. Is shock management needed? Are there spinal injuries? Secondary care assessment. Are there other injuries? Could they be ill? If bandaging is needed, start first aid bandaging. Do they need splinting for fractures? If a patient is responsive without immediate life-threatening situations, perform a sample history. S. Signs and symptoms. A. Allergies. M. Medicines. P. Past medical history and pregnancy. L. Last oral intake. E. Events leading to the emergency. Once the primary survey is complete and there are no immediate life-threatening situations, begin the secondary survey. Start with a head-to-toe examination. However, do not move a victim with a possible spinal injury. Falls, car or bicycle accidents, or an impact to the head can indicate spinal or neck damage. For possible spine or neck injury, the rescuer should help stabilize the head to limit movement by placing their palms on either side of the victim's head or utilize rolled towels. Continue with the head-to-toe assessment if you do not suspect head or neck injuries. Look and feel the injured person's head and face. Note any abrasions, bruisings, or fluids in the nose or ears, depressions of the skull, or damage to the eyes. Are the pupils equal sizes? Is the skin color and temperature normal? Is the skin dry or clammy? Look at and feel the neck for any tenderness, bruising, or deformity. Look at and feel the shoulders, collarbone, chest, and abdomen. Note any asymmetries, tenderness, or bruising. Slide your hand carefully under the injured person and feel along the back and spine for any tenderness, bleeding, or irregularities. Press on both of the protruding bones in the pelvis and see if there is any pain or deformity. Look and feel along the injured person's arms and legs for any bruising or deformity. Scratch both hands and feet and ask the injured person if he or she can feel the sensation. Ask the injured person to move their arms, legs, fingers, and toes and check for a full range of motion. If you need to leave an unconscious patient with intact breathing, placing them in the recovery position ensures that an open airway is maintained and limit the possibility of choking if they vomit. You will practice this with your instructor.